Learning about body is exciting, but it can get harder to maintain our interest when we are faced with all new terminologies of anatomy and physiology. Welcome to Science Era. In this video, we are going to learn just that, the language of anatomy. The learning objective includes verbally describing and demonstrating the anatomical positions, use of proper anatomical terminology to describe body directions, surfaces, and body planes. Then we're going to locate major body cavities and list the chief organ in each cavity. So let's begin. To accurately describe body parts and position, we must have an initial reference point and use the directional term. To avoid this confusion, we always assume that body is in a standard position called anatomical position. So this figure on the screen you can see this is the standard anatomical position. How are we going to describe it in words? We're going to say that anatomical position means that body is standing erect, facing forward with arms at the side and palm facing forward. So body standing erect, facing forward with arms at the side and your palms facing forward is the anatomical position. Why is it important to understand this position? It is important to understand this position because most body terminology used in anatomy and physiology refer to this body positioning, regardless of the position the body happens to be in. So, if you are going to explain something using anatomy and physiology, you need to assume that the body is in anatomical position, which means body is standing erect, facing forward with arms at side and palm facing forward. Next thing is directional terms. Directional terms are medical professional and anatomists use directional words or directional term to describe where one body structure is in respect to another. For example, if we say the ear are placed on each side of the head to the right and to the left of the nose. So, in an informal way, we can say that we are describing the relationship between ears and nose. This can be translated into the anatomical term. Using anatomical terms, we say that ears are lateral to the nose. Now let's look at other directional terms used in anatomy. So first one here on the screen is superior or cranial or also known as cephalic. This means towards the head end or upper part of the structure or the body, or in the simple way superior mean above. For example, your forehead is superior to your nose, which means your nose is inferior to the forehead. Inferior or caudal mean away from the head end and towards the lower part of the structure or the body, which mean below. If you use the example before, we say that your nose is inferior to the forehead, or other example is the navel is inferior to the breastbone. Next is anterior or ventral. This means towards or at the front of the body or in front of the body. So your breastbones is anterior to the spine, which means that spine is at the back of the body and your breastbones are at the front of the spine. Other term is posterior or dorsal. Posterior is the opposite of anterior, which means towards or at the back side of the body, behind. The heart is posterior to the breastbone, or you can say the heart is posterior to the ribs or mediastinum, whatever. Next is medial. Medial mean towards or at the middle line of the body on the inner side of the body. If you look at your arms in anatomical position, if you move towards your heart, heart is medial to the arm. If you move away from the center of the body, which means you go in the opposite direction from the chest, we say it is lateral position, away from the midline of the body on the outer side of the body. So we say arms are lateral to the chest, but heart is medial to the arm. Next is intermediate. Intermediate mean between or more medial and a more lateral structure, which is not medial or not lateral but in between those positions. For example, the collarbone is intermediate between the breastbone and shoulder bone. Next one, proximal or distal. Proximal means close to the origin of the body parts or the point of attachment of a limb to the body trunk. So you are going close to the origin of the body parts. For example, elbow is proximal to wrist, meaning that the elbow is closer to the shoulder or attachment point of the arm than the wrist is. Distal is the opposite of proximal, which means farther from the origin of a body part or point of attachment of a limb to body trunk. So we say that knees is distal to thigh. We are moving away from the body part. The last two are superficial or deep. Superficial, also known as external, means towards or at the body surface. For example, skin is superficial to the skeleton. Skin is towards the outside of the skeleton. And opposite will be deep or internal, away from the body surface, more inside or internal. For example, we can say lungs are deep to the rib cage. This figure is a quick summary of what we learned before, the anatomical position and regional terms. The figure shows terms used to designate specific body areas. So figure A is anterior view, which means from the front side, and the figure B shows the posterior view, the back side of the body. The heels are raised slightly to show the inferior plantar surface or sole of the foot, which is actually on the inferior surface of the body. So, if we look at the figure closely, we see that all the parts highlighted in the orange are the parts of thorax. In purple, we can see abdomen. In blue, we can see the back or dorsum side of the body. There are many visible landmarks on the surface of the body. In order to know those visible landmarks, we need to first know the proper anatomical names. Then you can be specific in referring to the different regions of the body, like this in the figure. For example, if we see the figure interior view cephalic. Cephalic refers to the head. Next, we are going to discuss body planes and section. When preparing to look at an internal structure of the body, we make a cut. This is known as section. When section is made through the body wall or through an organ, it is made along an imaginary line. We call this plane. Because the body is three-dimensional, we can refer to three types of planes or section that lies at right angle to one another. So the first one is sagittal plane. The figure shows the sagittal plane. A sagittal section is a cut along the lengthwise or longitudinal plane of the body, which means it divides body into right and left part. If the cut is down the median plane of the body and the right and left part are equal in size, it is called median section or mid-sagittal section, which means you are cutting down body right from the center of it. All other sagittal sections are parasagittal sections. So the figure shows mid-sagittal section. If you want to look at the MRI of the sagittal plane, you will see something like this: a vertebral column, a rectum, and intestine. Next is coronal plane. Coronal plane is a frontal section. A frontal section is a cut along a lengthwise. So we are cutting body in a lengthwise, which means that we are dividing body organs into anterior and posterior parts. Front part, anterior part, posterior part at the back part. So it is also called a coronal section. The MRI of a coronal plane will show you figure like this, which will include a right lung, left lung, your heart, liver, stomach, and spleen. These are all your anterior organs. You can see the anterior view of the body. The third one is transverse plane. Transverse section is a cut along on a horizontal plane, dividing the body or organ into superior and inferior parts. Superior is the top part of the body and inferior is bottom part of the body, like you can see in the figure on the screen. It is also called a cross section. The MRI for this plane will show you something like this, which will include liver, aorta, pancreas, spleen, subcutaneous fat layer, and spinal cord. Let's look at the summary of the body planes and section. So we know that there are three types of plane: sagittal plane, frontal or coronal plane, transverse, also known as horizontal or axial plane. Sagittal plane divides body into right and left part. Mid-sagittal is through middle line. Parasagittal mean off the middle line. Frontal or coronal plane divides body into anterior and posterior part, and transverse or horizontal, also known as axial plane, divides body into superior and inferior parts. Now we're going to discuss body cavities. As you can see in the figure, body is divided into two main cavities. The yellow one in the figure is dorsal body cavity and the pink one is ventral body cavity. Dorsal body cavity is subdivided into cranial cavity and spinal cavity, and ventral cavity have subdivision or called thoracic cavity, which is separated by diaphragm, and the other one is abdominopelvic cavity. Abdominopelvic cavity contains two types of cavities: abdominal cavity, all the abdominal organs are in the abdominal cavity, and the pelvic cavity. What is the purpose of these cavities in the body? These cavities provide different degrees of protection to the organs. Why? Because these cavities differ in their mode of embryological development and in their inner lining membranes. Many anatomy reference books do not include identify dorsal or neural body cavity as an internal body cavity. The purpose of saying this is that learning different body cavities is only for educational purposes and also to learn about what's happening inside the body, how organs are located and related to each other. Because abdominopelvic cavity is quite large, it is easier for us to divide it into, it is already divided into two cavities. So we further divide it into different quadrants. So we call them nine quadrants of abdomen. So quadrant number one is right hypochondriac. This quadrant includes your liver, gallbladder, right kidney, and small intestine. Second one is epigastric region. This region includes stomach, liver, pancreas, duodenum, spleen, and your glands such as adrenal gland. Then you have left hypochondriac, which will include your spleen, colon, left kidney, and pancreas. Then you have right lumbar region and left lumbar region. Right lumbar region will have gallbladder, liver, and right colon, while left lumbar region will have descending colon and your left kidney. Umbilical region contain, of course, umbilicus, navel part of the small intestine, and duodenum. Then you have seventh region, right iliac region, which will include your appendix and cecum. On number 8 is hypogastric region, which will include organs like urinary bladder, sigmoid colon, female reproductive organs. Ninth quadrant is left iliac, which have descending colon and sigmoid colon. So if you want to locate these quadrants, nine quadrants, we're going to say, for example, for umbilical region is the centermost region deep to and surrounding the umbilicus. Then for epigastric region, it is located superior to the umbilical region, or we say above stomach or gastric region. Then hypogastric region is inferior to the umbilical region, which mean below the umbilical region. Right iliac region and left iliac region are lateral to the hypogastric region. Iliac equals superior part of the hip bone. Right lumbar region and left lumbar region lies lateral to the umbilical region and spine column between the bottom ribs and hip bones. Then we have right hypochondriac region and left hypochondriac region, which flank the epigastric region and contains the lower ribs. In addition to the large closed body cavities we discussed earlier, there are several smaller cavities. Most are in the head and open to the body exterior. So the first one is oral cavity and digestive cavity. The oral cavity or the mouth contains teeth and tongue. This cavity is part of and continuous with digestive organ which open to the exterior at the anus. Next is nasal cavity, which is located within and posterior to the nose. Nasal cavity is part of the respiratory system. After nasal cavity, there is another cavity called orbital cavity. The orbital cavities or orbits in the skull house the eyes and present them in an anterior position. Anterior mean in front position. Middle ear cavities. The middle ear cavity is carved into the skull lies just medial to the eardrums. These cavities contain tiny bones that transmit sound vibrations to hearing receptors in the inner ears. Let's test our knowledge now. So the first question is, if you were dissecting a cadaver and wanted to separate thoracic cavity from abdominal cavity, which type of section would you make? So first we need to understand that thoracic cavity is superior to the abdominal cavity and abdominal cavity with reference to thoracic cavity is inferior to it. So we make a cut or section along a transverse plane. We make a transverse section. Next question is, which of the following organs are in abdominopelvic cavity? From spinal cord, small intestine, uterus, and heart. In the abdominal of these organs, the small intestines and uterus are found in the abdominopelvic cavity. Next question is, Joy went to the emergency room where he complained of severe pain in the lower right quadrant of his abdomen. What might be his problem? In order to answer this question, we need to first know what organs are located in your lower right quadrant of the abdomen. So we know in the lower right quadrant of abdomen, cecum and appendix is located. So we can say that Joy might have appendicitis. Next question says, what is anatomical position and why is it important that an anatomy student understand it? So, as we said, the anatomical position is a standard position that serves as a reference point in direction of the body and its structure. In this position, the body is standing erect, feet are parallel, arms hang at the side, and palm face forward. It is important to understand it because most descriptions of the body use anatomical terminology, refer to the body region as if body is in the anatomical position regardless of its actual position. The next question is, the axillary and acromial areas are both in general area of shoulder. To what specific body area does each of these terms apply? So, the axillary region is the armpits and acromial region is the points of the shoulder. Last question states, use anatomical language to describe the location of a cut to the back of your left forearm. So we say that there is a cut at left posterior antebrachial region. This was all about language of anatomy from my side. Thank you for watching. If you understand, please subscribe and share my channel. Thank you.